City of Milwaukee Health Commissioner, and I want to thank you all for joining me this afternoon regarding an announcement on a public health concern in our community. I'm also joined today by representatives from the state of Wisconsin Department of Health Services, AIDS and HIV program. Karen Johnson is here, and I'm also joined by representatives from Diverse and Resilient, who I will introduce in a few moments. Last fall, the Centers of Disease Control and Prevention began a formal investigation here in Milwaukee to determine why there was a significant increase in the number of HIV-positive individuals who have male-to-male sexual relations in Milwaukee. This was something that they've seen nationally. They looked back from the years 2000 to 2008, and they saw an increase here in Milwaukee. They concluded their investigations earlier this spring, and they have issued a preliminary report. A final report will be issued later next month. But based on the data in the preliminary report, we felt the need to have immediate action, which will be a part of a multi-tiered plan to address the increase in African American male-to-male transmission of HIV in our community. These increases are something that our entire community should be concerned about. These infections not only impact the individuals who are living with HIV, but those who love the individuals who are living with HIV, and those of us who are at risk of communicable disease in our community. So we all have to address this. Part of the city and the state of Wisconsin's response was to look at agencies within our community that had the capacity to hit the ground running now, to deal with a cohort that was identified to be between the ages of 13 and 29 years old. One of those agencies is Diverse and Resilient. They have a track record of dealing with individuals who currently have male-to-male transmission of HIV, or individuals who deal with the types of concerns that were identified by the CDC. And we have engaged them to start work immediately to assist us in not only education and outreach, but utilizing evidence-based proving interventions to help us reduce HIV transmission among black men who have sex with men in our community and across our city and then the entire state of Wisconsin as well. What's important here is that this is the first step in a multi-tiered partnership. We believe that Diverse and Resilient can serve as an agency that provides the initial framework to be a convener and an organizer to get the multitude of agencies that serve people who are impacted by HIV to come together later to address a strategic plan, develop a strategic plan that will deal with the issue of HIV transmission in our community. This is the first step, and we've chosen an agency that has expertise, and they will hit the ground running. Our overall goal is to reduce HIV transmission among males who have sex with other males in our community. We know that this will be a challenging endeavor. We know that community awareness and reaching consensus will require us to work together and to do that. I'm pleased to be joined today by Brenda Coley, who's the Director of Adult Services for Diverse and Resilient. I'm going to ask Brenda to share a few words about their impact and their current work in the community, and then I'll give you a few last statements about our strategy, and then I'll take questions. Brenda?
Welcome everyone to Diverse and Resilient. I want to let you know that the staff and the board of directors are delighted that Diverse and Resilient has been selected to lead this planning process. We are a 15-year-old HIV prevention and health promotion organization. We primarily work through groups and individuals to build the capacity of others to take action. We are very, very experienced in planning projects like this one. We have on staff 3 past community care co-chairs of Wisconsin's HIV Prevention and Planning Council. We have 2 staff who have been seriously involved in Wisconsin's health plans for 2010 and 2020, and our organization uses many approaches to engage in professionals and community members in planning processes. We enjoy the support of many community partners. We have engaged more than 700 African American MSM in the past 3 years. You know, we look forward to our community partners really stepping up and working with us during this process. And we will be tailoring our planning projects and plans, you know, based on really the input that our partners make during this process. So we're an organization, capacity building, and we work with groups, and with this population, we have very deep connection with the African American MSM population in Milwaukee.
Thank you very much, Brenda. So why act quickly and why act now? First, the CDC identified approximately 144% increase in the HIV seroprevalence rate among men who have sex with men in the African American community. The state of Wisconsin Division of Public Health further estimates that nearly 41% of individuals in that cohort could be HIV positive in Milwaukee County. This is a major public health concern, and we need to move quickly, and we need to mobilize our entire community to make certain that that happens. Why diverse and resilient? In the past 2 years, nearly 75% of the clients served by diverse and resilient have been persons of color. And during the same period, nearly 80% of the individuals served in their HIV program have been men who have sex with men. So they have the background and they have the mission to move forward with some evidence-based programs to handle this. What are we going to do next? What we're going to do next is to work on convening a multi-tiered strategy that would include all the other agencies in our city that currently serve HIV individuals or individuals impacted by that. We will look at the faith-based entities. We will look at large health systems and community health systems. We will look at the educational environment. We will get individuals together who are serious about combating the infection rate of HIV and AIDS in our community. But what we want to do most is to stand unified. We want to address the tough things to talk about in our community, the stigma that's associated with individuals who are living with HIV or may be impacted by HIV. We have to dispel that stigma once and for all and to work. We will have additional funding that we will identify in the coming weeks to fund agencies in a coalition fashion to do this work. It won't be easy, and certainly it won't be free. And we need to support the agencies that provide HIV services within our community. We will require everyone to stand firmly for some time. This is not a 60-day or a 90-day plan. This is a multi-year plan. The initial work to be conducted by Diverse and Resilient, however, will begin immediately at the conclusion of this press conference. In the next 48 hours, they will be on the ground doing work. And their work in the next 30 to 60 days will be significant as a part of the initial framework of things that we have to get done here. So on behalf of the City of Milwaukee and certainly Mayor Barrett, we're pleased to join forces today with a community agency that has capacity, has mission and motivation to work with individuals who are impacted by HIV, in particular those individuals in the African American community. And we hope that others will join us soon, and we'll have a collective forum of individuals who will address HIV and AIDS and the transmission and reduction thereof in our community. At this time, I'd like to entertain any questions that anyone may have.